I'm Dr. Vamsi Krishna. I'm the professor and head of the Neurosurgery department in Nizam Institute of Medical Sciences, Hyderabad, in India. And that's basically our hospital is a large university tertiary care center, like in the entire of the province and for the adjacent province as well. I have been there as a faculty. Now I am the professor and heading this department, and we do around 3,500 surgeries per annum. Like it's a huge training center with large volumes of complex cases with multiple subspecialties of neurosurgery done to very high level of specialization.
Thank you for introduction. And next, I would like to ask you several questions. First, we know that UB technique nowadays has been more popular around the world. And what do you think of the future of UB technique? And also, their UB technique is always compared with monoportal. So some people say that UB technique is a supplement to monoportal, and some people say that UB technique is the replacement of monoportal. So how do you think of this?
Yeah, see, the minimally invasiveness, like in the surgical field, and faster recoveries are the trend. This is what the societies, the people in the society demand, because that's the need of the hour. Because like earlier days, no one has time to sit in the hospital for 15 days, 20 days and take sick leaves from the offices and from their work for months together. So taking bed rest post-surgery, recovering, and there are not 10 people to take care of the people who undergo surgery, like which used to be the trend in the earlier, maybe 15 years back, 50 years back in the society. So in the fast pace, in the fast lane of that we live as human beings now, we want to have faster recovery, so it's the minimal invasiveness is the very essential to be there in the surgeries. And as far like the spine is definitely one which affects our mobilities to the pain and other things. So for us to be mobile, for us to be taking care of these things, I mean, it's absolutely essential that these surgeries are done with the endoscope, which just maybe with half centimeter and less than a centimeter incisions, like we are able to just do the work which we used to do earlier by open methods, which has its own flip sides. So, and coming to the monoportal versus biportal, like the monoportal has come, but the monoportal has its own limitations, because we have put all the instruments in one tube, and you can only see where the tube goes. So that's where the very surgeons who basically started this monoportal over period, who have been doing these surgeries, realize that there are huge limitations which happen with the monoportal. So they only came up with the biportal. So the working instruments which were previously trapped in one tube of 8 mm have been freed from that the boundaries of the tube, and have been given the freedom to navigate this and operate and do these procedures. So this the biportal technique, what we call it as now, where the tube has the camera and the other side has the instruments which are absolutely free. So increase the visibility of the instruments that we are operating, their freedom of movement, to the scope of reaching a much farther distance, much larger area, with the same instrument. So this has increased the scope of surgery, while it is already doing the kind of surgeries that were being done with the monoportal with the same level of precision, but with far more efficiency and much faster. So it has brought down the learning curve of the people. So in the sense, it's almost close to, a lot of studies say the learning curve in the biportal is it's almost 50% of the time period than what it requires in the monoportal. So in the sense, it's not that it's easy to learn and that's why it's superior or anything, because it has distinct technical advantages in terms of offering more conditions of which being able to treat with this one, with effective decompression of the spinal stenosis and other things. So apparently, like as I see it, it's the biportal which is going to stay. Like I think I already teach in our hospital and tell them like monoportal is coming to its end, and is the biportal which is going to stay. And every procedure that can be done by monoportal can be done by biportal, and there are more procedures which can be done by biportal, for which the monoportal is not the answer. So that's why I don't think, I mean, for me this debate exists of monoportal versus biportal anymore. So is the biportal, and that's going to stay, and that's what we teach our residents, and that's what is good for the patients. It's not from my perspective or anything. We are able to deliver far better outcomes with the biportal because of the access, the visibility, and the kind of the freedom of instruments which delivers safety to the patient.
Okay, thank you for your detailed explanation of this question. And just as you said, minimally invasive, this is the trend of the future, and the UBE technique just follows this trend. And regarding the monoportal versus biportal, it's hard to say, but UBE technique has its own distinct advantages, and I believe that in the future, the UBE technique will be more and more popular around the world. Okay, and
not just popular, like that. I feel, I mean, that's the only procedure that's going to stay.
Oh,
yeah.
So UBE technique will be the only winner at the end. Okay, and we know that this conference, this UBECON International Conference, is the first one in Nepal, and would you like to say something to this conference to wish its success or to show some more expectations?
Yeah, I mean, this is definitely the one of the event where people with expertise has been brought in, and I'm pretty happy with all the quality of lectures that have been delivered, and people with different exposures, different case, with other case experiences of different types, the expertise that they have brought in. So it's really a very good learning experience for us. While I share my own experiences, like the exchange of different tips and ideas, and the extensions of the future technologies that's coming in the UBE and everything have been very kind of interesting to learn, and as well to directly interact with the people who have been doing is definitely is going to be beneficial for every one of us. And for people who are non-believers in this, I'm pretty sure, like, I mean, they must have turned into believers of this technique after attending such events. Like,
okay, thank you. And I believe such kind of conferences will be valuable chances for you and your colleagues sitting together to share the thoughts together and exchange ideas together and grow together. Right? Okay. Thank you, and thank you for your time.
Thank you.